Hello and welcome into Talk of the Town. Lots of ground to cover on the show today and lots to talk about when it comes to physical therapy. And that's where we're going to start on this episode as we bring in Kevin Waite from the Sport and Spine Clinics. How you doing there, Kevin?
Doing well. Thanks for having me.
Yeah, thanks for joining us. Let's talk about, the healthcare industry in general seems to be changing a lot. How does physical therapy kind of fit into that model of treating patients?
Yeah, absolutely. No, as the weather gets warmer and people are getting more active, we're going to have 60 degrees next weekend. People go out and have a run. We're really that first line of defense if somebody has an injury to their knee or ankle or anything musculoskeletal, something painful in the muscle or joint. We are the go-to providers for getting that better as quickly, effectively, and actually less costly as possible.
So a lot of weekend warrior stuff.
A lot of weekend warriors. Yeah, we see a lot of those.
What's the most common condition that you see from those weekend warriors, and then how do you also help prevent that?
A lot of the most common condition we probably see is actually back pain. So not as much of the weekend warrior stuff is sometimes back pain. That's more knee and shoulder pain, sprain an ankle, that type of thing. But back pain is actually a giant problem in the healthcare industry. That's something that I see probably 50% of my patient load is back pain. And the way to prevent that is, it's a hard question to answer in a short period of time, but really trying to stay in better physical condition, have better body mechanics with lifting things, and actually just staying active. A lot of people that have chronic back pain, they get afraid of having more back pain, so they actually avoid different activities that will make their pain better.
So now when it comes to back pain, because the first thing that jumps in my head is back pain, go see a chiropractor.
Absolutely.
Now, should they see you instead of a chiropractor or see you in conjunction with their chiropractor?
Well, chiropractors and us, we have a different approach to how to get back pain better on some things. Some things we do similarly. We do mobilizations to the spine as well. We just have a different take on it, but our focus is more on getting muscles to activate, getting people to move better so that they're not avoiding activity, they're really enhancing their activity.
And speaking of those activities, as it gets warmer, we're going to see a lot more runners out there as well.
Yep, I'm excited.
Sure, yeah, right. It's got to be a busy time for you then.
Absolutely.
Because the runners get hurt. What are the more common things we see from runners getting hurt, and how do you prevent that as well?
The big thing people think about with running is shin splints and just overuse type of injuries. So the biggest thing that I see is people tend to get out and run too much too quickly as opposed to ramping things up. So it's a nice 55-degree day and people want to go out and run 5 miles when they haven't done it all winter. And so some people really know how to be a good runner, and they've done it for years, and other people try to get back into it because they want to lose weight, and they don't necessarily approach the get back into it the right way.
Now say, I've overdone it, I've hurt myself, but I think, I've seen a physical therapist in the past. I'd like to see a physical therapist again. Can I go right to seeing a physical therapist, or do I got to go through my primary doctor?
A lot of it depends on your insurance, actually. Unity is one of them that we can see you right off the street, and we still engage with the primary care physician because they're a critical part of the team, and we want to make sure that they are involved in that process. But a lot of people can come to us directly, and again, we are much cheaper, much less costly than a physician or downstream costs like getting an MRI or getting an X-ray or pain medication. That's another big problem these days is people get addicted to narcotic pain medications. And so our big mission is to get people off of that stuff so that they can get back to their lives faster.
Now you mentioned X-rays and MRIs. What if I think I need one? How would I know if I need one?
Well, you'd come in and see either your physician or come in and see us. X-rays and MRIs are probably one of the most overutilized and expensive things, more on the MRI side. MRIs are very expensive, $3,000 depending on where you are dollars. And a lot of times they're not really necessary to either change the plan of care, meaning change what we're going to do to get you better, or they're not really necessary to screen things out that we want to see. So especially in back pain, that's a big issue these days, is that MRIs find things classically that aren't necessarily important in the first place to begin with.
Now, say I want to have a home gym. I don't like going to the gym or something like that, or I want to set something up. What kind of equipment would you recommend?
I would recommend a bike or something that people enjoy doing. So, easy equipment to have at home. You can have different weight equipment, resistance training types of things like dumbbells, a bench. You can do a lot of like step up things for your legs and for your upper body with those types of pieces of equipment. But the main thing is trying things out, maybe going to a gym once or twice and seeing what equipment they have and what would be possible to have in your home. But the big thing is actually enjoying it, because most people, it turns out to be a laundry hanger rather than an exercise equipment.
Absolutely. Kevin, thanks for joining us today.
Absolutely, thanks for having me.
And we got more Talk of the Town coming up next here on CW 57. And welcome back to Talk of the Town. As moving along now, we get into a completely different area of what we have been talking about as we bring in Tiffany Reg from Madison Physical Therapy and Consulting. Welcome to the show, Tiffany.
Thank you.
Yeah, thanks for coming on. I always wonder this about people and their professions, but actually what got them started, what inspired them, what inspired you to be a physical therapist?
Sure. So I was a competitive athlete in high school and through college. And so I was actually introduced to the field as a patient. I was having some injury issues when I was running in high school, and so I had the good fortune of seeing an orthopedic surgeon in the Toledo, Ohio area where I grew up, and he had referred me to physical therapy. And through working with a physical therapist for about 2 months, I was able to get back competing, and also with significantly less pain and overall better strength.
Yeah, so basically then that kind of inspired you to help other people to do the same thing.
Correct.
Yeah, very neat. So now what type of physical therapy do you do at Madison PT and Consulting that was different than what you'd been doing in the past?
Sure. So I'm primarily a musculoskeletal physical therapist, so general muscle or joint injuries is typically what you see orthopedic physical therapists treating. With my particular business, I tend to see a fair number of workmen's compensation injuries, so people who are injured on the job, or third-party injuries, people who are injured in car accidents. And then because I'm right down in the hub of campus, I see a lot of athletic college individuals that choose to come to me based on location and affordability.
Okay, one of the things we had talked about before we started our segment here was there's a lot, if you look down on the bottom here in the bottom third in the graphics, you have a lot of initials after your name. What do all those mean, and why does that set you apart?
Sure, so the PT is, I'm a licensed physical therapist, so any state that you see a physical therapist in, they should be licensed and have passed a national exam. The OCS stands for Orthopedic Certified Specialist, and the American Physical Therapy Association does have a process of board certifying physical therapists in various areas of expertise. So the OCS is for Orthopedic Specialist. You may also see WCS, which is a women's specialist. You also see NCS, which is a neurological physical therapy specialist. The CSCS is Certified Strengthening and Conditioning, and that is through the National Strength and Conditioning Association. So a lot of times you'll see people working in the sports market or personal trainers with that particular certification. And then the last one, the CCI, is Certified Clinical Instructor, and that is another American Physical Therapy Association credential for having pursued extra training and taking on physical therapy interns. So students that are wrapping up their academic career that are going out and getting experience in hospitals and clinics by working directly under the supervision of another PT. Another thing that I'm currently working on is I went down to University of Tennessee. They have a veterinary, it's through their College of Veterinary Medicine, but it's a canine rehabilitation certification. So the people that can sit for that exam are physical therapists, occupational therapists, veterinarians, and vet techs. So I'm also working towards that.
Wow, lots of certifications, a lot of education, good stuff.
There's a lot of certifications out there.
Yeah, well, what does that mean for your business model then? You do something that's pretty unique with that?
So the orthopedic certified specialist just means that you're an expert of orthopedic-based physical therapy. There's about 200 PTs in the state of Wisconsin that have that certification. It's more of a means to stand out as an expert in the field by having taken that exam.
Okay, so now if people want to check you out, if they've suffered some kind of sports injury, need rehabilitation, stuff like that, how would they find you? What are your business hours? Tell us a little about that.
Sure, so I see my patients by appointment, which is a unique model for Madison. So that means I mostly work evenings and weekends. that is one of the appeals that bring people into my business is they have the ability to go see a physical therapist without having to leave work in the middle of the day. And that's very appealing for my workman's compensation side of the business, because if somebody gets injured at work but they can still remain working, it costs the employer a lot of money to pay them to leave. There's lost wages involved if they're leaving to attend appointments, and also lost productivity on the employer's side.
Lots to find out, lots to see. Check her out. That's Tiffany. Thanks for joining us on Talk of the Town. We'll be right back. And welcome back to Talk of the Town as we bring in Dawn and Amy from the Wisconsin Restaurant Association. And managing restaurants is something that I'm familiar with. I did it for 11 years, and so I know a little bit of what you do. But for everybody else, tell them what the Wisconsin Restaurant Association does.
Sure. The Wisconsin Restaurant Association is a not-for-profit trade organization, and it's for anybody in the food service industry. So really our whole mission is to make the food service industry a stronger one. We have an educational side to our organization, and that side of it works on making sure that the consumers are safe. So we deal with a lot of food safety regulations and requirements.
I've taken those tests in classes, yeah.
Yeah, have you passed them?
Absolutely.
And then we've got this great educational component to it too, of really fostering the youth that are going through the high school curriculum with our ProStart program, and really trying to make sure that we have a strong workforce in the future.
Very cool. Now, you also get to produce the Midwest Food Show that goes on in Milwaukee, so the Food Service Expo. Talk a little bit about that. What is that all about?
Well, the Midwest Food Service Expo is our annual show that we've been hosting since 1933. So we've been around a really long time here, and that's about bringing together all of the food service industry. So it's a trade-only event. It's not open to the general consumers, but it's intended for anybody that's employed in or owning a food service operation to really come there and see what are the latest consumer demands that are happening right now out there. The trend reports always come out at the end of the year, so our show is positioned in the first part of the year to give food service operators a chance to come and really kind of ignite their creativity and look forward to the upcoming tourism season, to be able to change up some things that are going on in their businesses and really address a lot of those consumer-driven trends that you see coming out in the menus. So we have tons of exhibits going on over the 3 days, anything from decor to food ingredients to software solutions, and just a lot of professional development and bringing together the community of food service operators.
Okay. Not only was I in restaurant management, I did the restaurant tour thing for a while, which is really challenging. Now, are some of those challenges also addressed at the expo?
Yeah. For sure.
There are many.
There are many. Yeah, independent food service operators in particular, it's a grueling schedule for them. There's a lot on their plate, and we really try to address some of those challenges to make them better operators in their businesses. So at the expo, labor shortage, huge right now in our industry. It's predicted to be over the next couple of years an issue, and so we're really kind of nailing that this year with the recruitment and retention side of things. We're trying to bring in different options for people to consider for where to go for resources for hiring. But it's super competitive right now. And you look at too just the generational differences. Any restaurant can have 3 or 4 different generations working in it. So it's about understanding the dynamics of those millennials compared to those traditionalists or boomers that are running these operations.
And they are so different. And everybody who knows a millennial knows that, and it's just a different world. You know what's been different a lot lately too there's been a big emphasis on buying local. Is there a Buy Local conference there as well?
Yes, we are having a Buy Local conference as well. And you may have experienced this. We're finding in our research that restaurateurs really want to buy local, but it can be a little bit overwhelming if it's something that they haven't done before, a lot of misconceptions about what is involved. So we are going to be having numerous educational seminars, both at your introductory and advanced levels for these restaurateurs to attend over the Buy Local conference.
Yeah, there. I was in Arizona for a little bit too, and we opened up a gastropub, and everything had to be local, which is really a challenge and very hard to do, but very neat if you can actually pull it off. So quickly, we got about 30 seconds. What are some of the other things we could see at the expo?
In conjunction with the Buy Local Conference, we have partnered with the Wisconsin Department of Agriculture for the last 4 to 5 years with their Something Special from Wisconsin pavilions. So now there'll be we started with about a handful, and now there'll be over 40 companies, specific Wisconsin-based food and beverage companies. We also will be composting this year at the expo, which really speaks to the millennials and the younger generations. So we're looking forward to having anybody affiliated with food service attend. Unfortunately, we're not open to the public, but anybody affiliated with food service and hospitality.
Get out there. Don and Amy, thanks for joining us and talking about the WRA and the Food Service Expo that's coming up, as well as we'll continue here on Talk of the Town on CW57. Welcome back to Talk of the Town, and ni hao, as we get to talk some acupuncture now. I'm very excited about that as we bring in Chef Wei, and she is part of Harmony Acupuncture and herbal medicines as well. So, very interesting topic, as far as, I believe when it comes to acupuncture. Talk about your background, I guess, a little bit when it comes to being an acupuncturist. What's your education? How did you get started doing it?
I graduated from Changchun University of Traditional Chinese Medicine in China back in 1986, and practiced in the clinic after I graduation. The clinic is called Jilin Research Institute of Traditional Chinese Medicine before my family moved to U.S.
Okay.
So I started practice in medicine and the surrounding area in 2000. So combine the experience in China and medicine, Wisconsin, have been practiced for over 25 years.
Wow, that's a lot of practice. So yeah, you've definitely seen a lot of things, and you've seen a lot of conditions. What conditions do you treat?
Women's health issue for sure, pain management like arthritis, we are all aging, and injuries, we fall and trip, and headaches, migraines, and insomnia, anxiety, depression, fatigues, and side effect from cancer treatment like nausea or neuropathy. Those are pretty common side effects from chemo treatment. Of course, a GI problem. Acupuncture doesn't treat everything. However, if there is a health condition has not been resolved yet, give acupuncture a try. You might be surprised by the outcome.
Yeah, and it's definitely something different. I think a lot of people, are afraid of getting stuck with all the needles. How exactly does acupuncture work?
Well, acupuncture is based on the theory of energy flow through the body along the network called the meridian. Meridian related to all the organs like your stomach, your heart, your spleen, gallbladder, kidney, lung, intestine, etc. And you mentioned the stuck needle, and acupuncture is inserting the needle into the points that sits on the meridian. And those meridians, of course, relates to the organs, so acupuncture help the energy flows better and the organs function better.
Now, you mentioned women's conditions, and you treat a lot of those. Can acupuncture actually be used to treat something like infertility?
Oh, absolutely. I have treated infertility patients extensively. And infertility could be caused by many conditions. However, sometimes they just cannot find the reason. So patients with a diagnosis called unexplained infertility. And I use acupuncture and herbal medicine to treat many patients. Most of my patients now have healthy babies.
Really? Okay.
Yes.
How long does it take them to get pregnant once they usually start the treatment?
Usually, average take 6 to 8 months.
Okay.
use acupuncture and herbal medicine. However, everyone's different, and some patient takes 2-3 months, other patient takes more than 8 months.
Okay, so now if a patient's doing IVF, can they still be doing acupuncture?
Oh, absolutely. IVF is a very intensive process. Acupuncture helps to increase the lining of the uterus, help the blood flow, and help increase the chance of implantation, and help patient reduce stress, relax, and decrease anxiety.
Seems like a great way to treat a lot of conditions, and definitely for women that are experiencing problems. Yeah, a
Yes.
great treatment to go ahead and try. Xie, thanks for being with us so much.
Oh, thank you.
Yeah,
Thank
xie.
you.
Yeah, so yeah.
不客气。
Yeah, I tried all my Chinese. There it is, right there. I got it all out. But thank you very much for being with us. Yeah, very interesting topic, and we thank you as well for joining us right here on Talk of the Town on CW57. We'll see you next time.